came to here at Wesley because I was probably at a stage of my career where I've worked for a long time in the area of eating disorders. I've worked in clinical settings in the public service predominantly, and I've predominantly been an academic psychiatrist, so working in the university centres. And this was a sort of a different challenge, a new challenge, and an interesting thing to sort of move into a role of developing and being a leader of an eating disorder service, or a leadership role, where I could really contribute sort of my experience, my expertise, and I hope bring added value to an already existing good program. I really would like it seen as a centre for excellence in eating disorders, both in terms of integrating the best clinical practice, but also contributing to knowledge base in eating disorders, contributing through research, and also contributing to the next generation of health professionals and people working in the area through teaching medical students, undergraduate psychiatry trainees, as well as graduate and undergraduate psychologists, as well as people in other disciplines. I know we already do that, and we have a very good relationship with some universities and with Western Sydney University with the Masters of Art Therapy, but I think there's a lot of room to develop further in terms of teaching. It's what I call closing the treatment gap. We know that there are evidence-based treatments in eating disorders, particularly for bulimia nervosa and binge eating disorder, but also increasingly in anorexia nervosa, but that the majority of people with eating disorders don't access those treatments. So understanding the reasons for that and then redressing those reasons and closing the treatment gap, I think, is our biggest challenge right at this point in time. We still have the majority of people really with eating disorders not properly accessing evidence-based care. I think we need to listen to patients and listen to their carers. I think sometimes we haven't done that as well in the past, and I was very excited. I was part of an international conference where I was the conference convener in New York, where we had someone who had suffered an eating disorder actually do the keynote speech at the conference, which was a first for that particular conference, but it was just absolutely fascinating. He's someone who writes for the New York Times. He's someone who's had a past history of bulimia nervosa, Frank Bruno, and spoke in a way that gave us lots of insights as to how he helped himself in terms of his own recovery from his eating disorders. So I think that's probably where I would say I've learnt most, is to actually listen to patients and listen to people caring for them. The other aspect is probably never to underestimate the power of the eating disorder of anorexia nervosa, how strong it is, how much it really gets in the way of people living a full and functioning life, and also impedes their accessing treatment and impedes their pathway through treatment. So we really have to help support people in that in better ways, I think. I think it's very much respect for each other's disciplines and respect for each other's expertise, and working within your own discipline and area of expertise but contributing to the team. So it's rather like systems theory, that the sum of the parts is greater than each on its own. So we're all bringing different things to the team, and as such we're creating a much stronger therapeutic armamentarium really to assist people. And with anorexia nervosa you do need a team. However you do that, whether you do it as a virtual team or as here at Wesley where we are a team, we're all on site together, but you definitely need a team. The major one will be of the university, Western Sydney University, because that obviously provides the infrastructure, the place where I work with other students and other researchers to be able to advance knowledge, and provides that crucial support that researchers need in this day and age to do that. I'm involved with a postdoctoral student also at Macquarie University, for example, so other universities are important, and she's the one who set up a scheme whereby we can start collaborating and getting our clinical data from patients grouped, so we can truly study what is happening to our at the sort of patient level in terms of outcomes. And as well, I'm involved with the local healthcare district with Campbelltown Hospital, and that I see as complementing this role. It's where I do have my own clinic, and I'm face-to-face with my own patients, and also offering a sort of outpatient service to the people from the southwestern area. And I hope that that would dovetail. Some of my patients there may well be able to, and have actually come to Wesley Hospital for their treatments. So it's not a conflicting role. I see it as a complementary role, and where I can bring students as well from the university and from the southwestern area.